Welcome to today's video series on an introduction to breastfeeding. Chapter 1, Hand Expressing Before Delivery. At one of your routine prenatal visits in your third trimester, myself or one of the doctors will provide you with a hand expression kit. This kit is intended to be used after 36 weeks at home to start collecting colostrum. Colostrum is the first milk that your breasts produce and is an ideal food source for baby in the first 3 days. The kit will include 3 syringes, a small medicine cup, an instruction manual, and a little baggie to bring those syringes to the hospital with you for birth. The purpose of trying to hand express in the weeks leading up to your delivery is to not only increase your milk supply, but to also provide pre-filled syringes for your baby should your baby require more food than what he or she is getting at breast. Chapter 2, the transition from colostrum to breast milk. As indicated in the last chapter, colostrum is the early milk that your body produces in preparation for your full-bodied milk supply. This is really handy to collect and bring to hospital, as I've said previously, in case we're having difficulty with breastfeeding and your baby is still needing some food source in the first couple of days. There's a natural grace period in this time frame where your body is hormonally driving breast milk production and it is not a supply and demand system. Therefore, it's a natural opportunity for your baby to focus on the dynamics of breastfeeding while not worrying about, am I going to have enough? Colostrum is highly nutrient dense and at a much lower volume and quantity than you would expect with your full-bodied milk supply, which we'll talk about shortly. During this time frame, the key is to focus on comfortable latch, deep enough latch, and enough time at breast to facilitate good colostrum transfer. Next, day 3 to day 5 after you've given birth to your baby is when the full-bodied milk supply is going to start. This is a much higher carbohydrate and water volume. You're going to experience engorgement, and we're going to talk about more supply and demand dynamics in an upcoming chapter. Chapter 3 is latching and basic breastfeeding setup. Before we talk about my latching principles, we're going to discuss prime breastfeeding setup. First, we're going to focus on your comfort. Your comfort is key in order to sustain breastfeeding and to have maximum flexibility for as long as you choose to breastfeed. This is going to include 1, optimal positioning, which involves softening your shoulders and not increasing back or arm tension, having good back support in a chair or in a bed if you're still in the hospital, and good leg support. 2 is going to be pillow use. So as you're bringing your baby tummy to tummy and chest to chest, you're going to have enough pillows around your baby, and under your arms that it's going to support their weight. The role of your arms and your body positioning is just to support the structure of the feed, but you're never intended to hold up the weight of your baby. So you may be using a breastfeeding pillow like I have shown here, or you may be using other various pillows at home from your bed or your couch. 3, we're going to focus on in the first week, not using a nursing bra or not wearing a top in the early days as we're starting to dial in that latch and making sure that it's deep enough and comfortable enough. Secondly, baby should be naked, just with a diaper on, to facilitate skin to skin and as much stimulation biofeedback for them as possible. Chapter 4, Latching Principles. In this chapter, we're going to discuss the latching principles of smoosh, pull, pop. Initially, with smoosh, after you've identified early to mid-level feeding cues, which have been reviewed in the office with you at a routine prenatal visit, early latching cues, as a quick review, look like hands to mouth, moving their head back and forth, opening their mouth, sticking their tongue out, and other sort of rooting or chicken pecking that you may identify when holding baby skin to skin. This is a perfect time to try latching, and my best advice in the first week is take most baby movements as a possible feeding cue. This way we can establish good latching, comfortable feeding, either whether with colostrum or your full-bodied milk supply, and then we will continue to build with complexity about gassiness or sleeping cues at a later date. As you're bringing baby to breast and you're waiting for that open, wide mouth, I'm hoping that that mouth is wide enough that they could stick their whole fist in their mouth, meaning you're going to get that nipple in as quickly as possible to do as little damage and minimize discomfort for yourself. There are 2 conventional holds that we're going to talk about in this video. First is modified cross cradle, where you're going to apply a U or under breast hold and having your baby perpendicular to your body, latched on as shown here. Otherwise, we're going to talk about football hold, which has the same latching principles, but this will be where the baby is tucked underneath your arm and you're going to produce a C hold in shaping your breast from the side. When you go to latch baby on in a smoosh, if I was feeding on my left-hand side with baby in a modified cross cradle, I would provide that under C hold far enough back from the areola that you can get as much areola in their mouth as quickly as possible. Sometimes you can even tease that nipple across their lips to encourage that really wide open mouth, and then you're going to smoosh. And smooshing involves, as you can see, my hands are placed on baby's neck and their shoulder blades and my forearm tracking along their spine and near their legs. The smoosh is going to be a fairly firm application of baby to your breast, firmer than you initially will think is comfortable, but you want to get that nipple as far back in their throat as quickly as possible. That face should be very squished into your breast tissue. So in that circumstance, maintain that firm hold underneath, apply a little bit of thumb pressure just in front of their nose so they're not having to choose breathing over eating, and you're going to maintain that firm pressure for 30 seconds to a minute. Now, in that first 30 seconds to a minute, you may feel really sharp stabbing discomfort. This does not necessarily mean that that latch is poor, but if that sharp and painful sensation lasts longer than a minute, I want you to break that latch using your pinky finger in the corner of baby's mouth, pop them off, and reinitiate that initial latching step. Now, in a good latch, you may feel that 30 seconds to a minute of sharp pain, but then after that minute mark, you're going to feel a lessening of that sharpness and just feel sort of a dull suction or dull pressure that may not feel terribly comfortable, but it's not going to be sharp. Now we're going to move into step 2 with a good latch. So again, in cross cradle hold, if baby has a good latch on that areola and on that nipple, then your second move is going to be to pull that baby back towards your opposite arm about an inch or so, just to angle their chin and forehead up into a sniffing position. And that's going to facilitate a little bit more deep latch work. So that nipple is going to be further in the back of their throat and not touching any of the surrounding tissue in their mouth. Now, if that also goes fine, baby remains latched on nice and deep, then we're also going to do then step 3, which is pop. Popping is going to include maintaining that hold. You're going to apply a little bit of additional heel pressure between their shoulder blades in order to keep their chest puffed out and maintain that angled chin and angled back forehead. Now, if all 3 sections are going fine, baby is feeding with some level of urgency, then if that baby continues to be latched on for 15 to 20 minutes, check mark, consider that a good feed. In the early days, you won't know exactly how much food that baby's going to get, but lack of pain or that shift from sharp pain to dull suction and that time frame of 15 to 20 minutes of good regular eating without long sort of pauses and sleeping greater than a minute between sucking, you're well on your way. Birth of your baby to day 7. The first day of your baby's life is technically called day 0 until the first 24-hour mark. Your only goals in this time period is 1, to start getting comfortable identifying feeding cues and giving your baby ample opportunities to try latching and feeding for 15 to 20 minutes. And secondarily, just to get comfortable getting to know your baby. Nurses and myself or the doctor are going to pay close attention to your baby's vital signs in hospital, and we'll also be looking out for baby's first poop and first pee. Day 1 and beyond, we have greater qualifiers for how often you should feed your baby. Unless you've been told otherwise, we want your baby to feed at least once every 3 hours. They can always feed more often if they're cueing more frequently, and we encourage you to do so. In the first 3 days of life, like I've indicated in a previous chapter, you have colostrum, which is hormone-driven, not supply and demand-driven. So this has an inborn grace period that you can feed from your right side, feed from your left side, and vice versa, flip-flopping on either side for varying lengths of time without a long-term impact to your milk supply. There can be circumstances where your baby can be sleepy and may require you to set an alarm in the first week in order to meet a minimum of 1 feed every 3 hours. And if delivery is uncomplicated and you have no other concerns, then we likely will send you home from hospital within the first day to 2 days, and I will follow up with you at home with a number of home visits to help support breastfeeding and your transition back to community. Once your full-bodied milk supply comes in day 3 to day 5, you're going to experience the following. 1, often a large mood drop as your estrogen and progesterone levels are returning back to pre-pregnant levels. 2, significant or even moderate engorgement, meaning firmness and lots of fluid influx to your breast that can cause some pressure and tension. So, maintaining your doses of ibuprofen and Tylenol now that you're not pregnant is ideal. 3, focusing on feeding single side or one breast per feed is also my best advice. There's often an inclination to feed maybe for 10 minutes on one breast once your milk comes in. And then once your baby starts to fall asleep and get tired, to switch to the second breast in order to keep them stimulated. In this circumstance, you may be losing out on a prime opportunity to fully drain your breast and signal your breast to continue keeping up with your baby's nutritional and caloric needs as the days go on. In that circumstance, as an example, let's say I'm feeding little Jimmy here on my left-hand side, and if he's giving me really good effort for the first 8 to 10 minutes, which is often the portion of the feed that is most foremilk dense or carbohydrate and water dense, but then starts to fall asleep, what I'm going to do is continue to hand express to keep him stimulated while he's latched on to try to lengthen that feed to that previous 15 to 20 minutes if we can. If Jimmy is still hungry after that 15 to 20-minute mark, we can unlatch. I can hold him or her in a habitat position. And if they're still cueing, then we're going to move to the opposite side, whether in that cross cradle hold or the football hold. Other troubleshooting that's unique to you and your baby will be reviewed with yourself and myself at an upcoming home visit after you've given birth or at a routine prenatal in the office just before giving birth. Do have a number of hot tips and resources from other families that I've collected over the years that I'd like to share with you here. First, a great item to have on hand are silverettes. These are things you can actually grab on Amazon as a knockoff and not pay top dollar for the actual silverettes. That's a great tip, and we can discuss their application in office or at a home visit. 2, a haka. A haka is something that you can get at Begbie Kids, or you can also, again, order online on Amazon. Say it's a silicone hand pump that can be used for either breast milk collection, specifically if you're hand expressing, or if you're leaking milk and you're feeding on a single side, you would put that haka on the opposite side. Or if you have some other clogged ducts and troubleshooting, and we can discuss that further in office as well. Thirdly, if you're considering combination feeding or long-term wise, breastfeeding plus pumping and bottle feeding, if you're planning to go back to work or just for lifestyle considerations, then this may be something you may want to organize and arrange ahead of time. From my few years of lactation consulting and being a midwife, the Spectra pump, which is now available in Canada, seems to be a hot ticket item and is really priced affordably. Thirdly, if you are pumping, collecting milk in a haka, or hand expressing, just make sure that you do have some appropriate receptacles or bags on hand in order to not only store your milk in the fridge, but to continue to freeze it and keep it fresh in the freezer.